Hey, welcome to the Dr. B Show. Today we have Dr. Braegelmann in today. So this is Brittnay. She's our head physical therapist here at Rejuv. And we're going to be kind of talking today a little bit about physical therapy, how it blends with our clinic here, and how it can really just be a great service to our patients. First of all, Brittnay, I kind of want our people out there just get to know you a little bit. So kind of go back in time and just tell me, how did you first fall in love or get involved with physical therapy? And you said that's the career that you wanted to do.
Well, when I was in high school, I always knew that I wanted to help people. That was just always something in my heart, and being able to do that just makes sure that it's rewarding for me too. So when I was in high school, I had it narrowed down to a couple of different fields. One was teaching and coaching. I grew up a coach's child myself, and I decided that I wanted nights and weekends. Oh, yeah. And as a kid, it was absolutely fun being able to ride the bus and being in the gym and doing all those things, but I really wanted that time with my family. So then I went more into the sports medicine aspect, and I was trying to decide whether I wanted to do physical therapy, athletic training, or even orthopedic surgery. And athletic training got knocked off because of nights and weekends, as fun as that would be. Orthopedic surgery got knocked off because a majority of the time the patient is on the OR table.
Right.
And I really thrive with that interaction with people. And so being able to not only help them get better, but getting to know them as a person is really, really impactful for me.
Yeah, for sure. So for those that are listening to that might be interested in physical therapy, kind of go back to undergrad and things you had to do to prep for it, and then the PT school itself as well. What's that like? And for someone listening that might think that sounds like an amazing career, what should they be thinking about right now?
So the good thing with physical therapy with your undergraduate degree, it can be in anything.
Yeah.
So in my class, the most common was biology, exercise and sports science. I was a psychology major. We had sociology, so it was just all across the board. And so whatever you want to get with your undergraduate degree, and that can take anywhere from 2 to 7 to 10 years. It doesn't matter how long it takes, as long as you get your bachelor's. Then you can apply for PT school. And typically the PT programs are at least about 3 years. And so after that, then you sit for your boards and you get your doctorate in physical therapy.
Yeah. Then you thought, I want to do a little bit more. So you actually did a fellowship program. So tell us about that and how that's really helped you.
So I did a year-long program where we got to specialize in sports physical therapy, and that did everything from I was working in an orthopedic and sports medicine clinic. I was spending time in high school and collegiate athletic training rooms. I got to help with the Minnesota Lynx.
Oh, neat.
And by help, I mean I got to sit there and watch and learn the physical therapist on staff there. And that was the year that they won one of their championships.
Wow.
So that was pretty cool to be able to be involved with that team too.
Yeah.
And then a lot of community outreach as well. So education and research and teaching. So it not only working clinical hours, but outside of everything, it was probably, I don't even want to know, but probably 60 to 80 hours per week that you put in. But it was worth it. And I learned so much in that 1 year. I said I learned probably like 5 years worth of knowledge within that 1 year.
Oh, yeah.
So it was so beneficial to really learn the area that makes me excited to treat. And then after that, you sit for another board exam. So now I'm board certified in sports physical therapy as well.
That's great. It's nice to have that niche too. So back into psychology. So psychology, obviously, for all of us, would be very helpful. Do you feel like you're using that too every day with these patients and just understanding their psychological aspect of this pain and disease?
Yeah, absolutely. It's not something that I don't treat like a psychologist or a psychiatrist by any means, but it helps me understand the human brain and the human emotions and how that it impacts physical pain, and ways that we can kind of work together and through those things to get them better.
Yeah. I think psychology is important for everything. Understanding human, how we interact, how we react is so important. So then you graduated, went into the field of PT. Kind of tell us a little bit about what's it like to be a physical therapist every day. What kind of things are you treating? for those that don't really understand what PT does and the benefits of it. So kind of talk about just an average day, what you're seeing and some of the things that you're doing during the day.
Well, I love working in an outpatient setting because people come to you because they want to get better. So we instantly have this patient population that they're their own advocates. They want exercise. They want to do things to get better. So we see everything. I think the youngest we've seen here is a 2-year-old to over 100 years old. Wow. Everything from an acute injury like an ankle sprain to having surgery after a regenerative medicine procedure. Chronic pain after a motor vehicle accident. We see the full gamut, and that's what really makes it every day is unique, and every day you use your brain and you get to figure out what are the best things that you can do to help all these types of people.
Yeah. So think about some of your favorite patients and what that's like, because one thing, in medicine and physical therapies, we get to be really almost good friends with our patients. And so tell us about just personally some of the benefits you get from seeing patients, that relationship that you're creating. What's that like as a physical therapist?
I think one of the biggest compliments that I've gotten recently is treating a younger athlete, and then by the end of their rehab journey, they want to be a physical therapist.
Oh yeah.
So to hear them and know how much that they valued their time here, and to see what we do as a profession and being able to give that back to somebody and hopefully help the future generations of our PT career.
It's important. It's important to give back and inspire and get that next generation into it. So too, with all of us, we have these challenges. Every part of our job has a challenge. So tell me about some of the challenges you face as a physical therapist, whether it's one big challenge you've faced in the past or kind of something that's kind of a recurring challenge that people have to be aware of and get ready to be aware of those things so they can tackle those through and get, make their patients better still. So what's some of those challenges you face?
I think one of the biggest growth areas that has occurred for me personally is I've learned that I can't help everyone. I can't make everyone 100%. And that's what's so great about working here at Rejuv Medical. It's not all on me. If I can't do it, well, I have coworkers, I have different specialties where I can try to get that patient over there, and then we can really try to work together as a team to get them better. As a new grad, I took it very personally if I couldn't get someone better. I'm like, I know this is, in the textbook, or I can figure this out. But sometimes people need more than just me. And so as humbling as that is, it's phenomenal to work here and be able to use every other brain here to help people.
That's true. So we always say Team Rejuv. Team Rejuv is definitely a team approach. We all have our different kind of specialties and what we bring to the playing field. So tell me what's like working at Rejuv. And Rejuv is a little bit different than your standard orthopedic clinic, because our goal is to maybe not always cover things up with pain medications. We're trying to get away from things that can be damaging, like steroid injections that we know can cause more damage to the joint or more damage to the spine. So it's definitely a different type of a job for therapists, because we aren't using a lot of the same modalities. You're not doing a lot of post-surgical cases, although you are seeing some of those with some of the referrals. But tell me how working with Team Rejuv is a little bit different from a standard physical therapy clinic.
Mm-hmm. So I think the key here is that, like you said, it's not just a Band-Aid. It's not just putting something on and then sending them out the door. Well, we want them not only to feel better, but we want them to stay better. So it's finding all those things that even if we fix problem A, why was that even a problem in the first place? So we all work together to put all of these puzzle pieces one by one together to make sure that we can, like I said, not only get the patient better, but keep them feeling better.
Yeah, that's so important. That team approach, too, I think once you come through Rejuv, you realize, man, it's amazing, because we all have the same philosophy. We have the same heart. We just want to do what's best for the patient. And at the end of it, once they've kind of seen all of us, I think that's why I love going to work, too, is just the testimonies and hearing patients' lives change. And it's definitely inspiring, that's for sure. Tell me a little bit, too, about, for that aspiring student out there that wants to do physical therapy, what are some things they should be thinking about? They're in high school, or they're kind of about to enter college. What are some things they should be thinking about as far as, okay, I think this sounds amazing. I want to pursue a career in physical therapy. What should they be doing right now to make sure, because it's super competitive. I've had a lot of people, I didn't get in, or what are the things they can do to kind of prepare themselves for that whole application process?
So I think the more that you can do, the better. And as stressful as it is as a younger kid, if you can show that you can multitask and you have all this on your plate, because that's what grad school is, right?
Yeah.
And that's what life is. And so if you can instill and learn that skill set at a young age, then it's going to carry over and make it easier. Not that it's going to be easy by any means, but it's going to be easier to multitask and do everything that's being asked of you in your undergrad and graduate career. So whether that's shadowing other physical therapists, I think doing any sort of leadership things, whether that's being involved in a team, whether that's being involved in a community or some sort of youth group, anything that you can show that you're willing to go above and beyond, and will make your application sit just a little bit higher than that other person's, because everyone's going to have a high school diploma.
Yeah.
Everyone, is going to have an undergraduate degree. Yeah. It's what extra things did you do to show that you have the skills needed to have a demanding career.
Right. And I think, like you're saying, be diversified. If you like music, be a music major. If you like art, you can be an art major. But I think those things do stand out. I think same thing with me. I was an art major in undergrad, and I was competing against a lot of biology majors. And after a while, when the committee sees 10 biology majors, you do stand out. When you're an art major or you're a psychology major, it's like, oh, there's something different. So I think pursue what you love and then add on whatever else is above that as well. So as far as you, tell me about why you love physical therapy and kind of why you still love going to work, because you've been doing this for a long time, but you still seem to come to work and you're happy, energetic, and you've just got a positive vibe about you. So what is it that you love about your job?
I think the biggest thing that I alluded to and mentioned prior is just helping people. Yeah. And I tell this with a lot of our students, and it's crazy how pain can change personalities. But the patient that comes in and they're in so much pain, and maybe they're emotional, they're upset, they're crying, they're a little cranky, and then you get to see their progression over their time here. And by the last day, they're giving you a hug. They're the kindest person. And you just don't realize how physical pain can manifest in a personality. And seeing that person on the first day, and you're like, oh, this one's going to be a rough couple weeks here. Yeah. And then you see them start to turn and you see them start to change. And as they're physically doing better, they just light up. And it's so cool to see that in patients.
Yeah, I love that. I love the after, and the testimonies are awesome. So, well, thank you, Brittnay. It's been fun. Can I get to know you a little bit better? And if anybody out there has any issues, chronic pain, wants to know more about what Brittnay can do for you, just come see us at Rejuv here. Team Rejuv is always, willing to help and hear your story and help you out. So thanks a lot, Brittnay.
You're welcome.